Three, go.
Good morning. We're here at the Heart Health event to bring awareness to all the services that the Fargo VA has for to keep a healthy heart for our veterans. I'm here representing Women's Health. I'm Irene Johnson, the Women Veterans Program Manager. Just wanted to share with our women veterans just that awareness that this is not something that just affects men. It's certainly something that affects women. In fact, one of three women 1 in 3 of the deaths that occur are for women is heart disease. And so bringing that awareness that there's things you can do to help prevent that. Certainly you want to avoid smoking, you want to watch for your cholesterol numbers, and you want to look at high blood pressure, and then doing those things to keep it healthy: exercise, healthy diet, and especially know your numbers.
Hi, my name is Brittany Soley. I'm the Health Promotion Disease Prevention Program Manager, and here also representing my primary care department and talking about the signs and symptoms that we should all be aware of for a heart attack and stroke. It's very important that we all learn those signs and symptoms because you never know when you're going to need that information, and those situations are a true medical emergency. So for men and women, the most common symptom we notice is chest pain. But other symptoms that you may notice if you are having a heart attack include nausea or vomiting, jaw, neck pain or back pain, squeezing chest pain or pressure, or shortness of breath. That's pretty common in both men and women. Now for women, there's also some other generalized symptoms that people have reported, including feeling more pain or pressure in the lower chest or upper abdomen, fainting, indigestion, or even extreme fatigue. And those are easy to ignore of symptoms, but if you're just not feeling like yourself, you probably should go in and get checked. Now, when we look more at strokes, the most common symptoms that we see with those is facial drooping, arm weakness, speech difficulty, vision problems, just trouble with coordination and balance compared to your normal, and a severe headache without a known cause. That's pretty common for both men and women. But for women, we also see some other generalized symptoms like just feeling weak compared to your normal, maybe confusion, memory problems that come on suddenly, fatigue, or also nausea and vomiting. And so again, learn those symptoms because you'll never know when you need that information. And if you or someone you know is experiencing those symptoms, call 911 immediately. And of course, prevention matters. One of the best things you can do to help prevent a heart attack and a stroke is to be seeing your primary care provider on a regular basis. You should be seeing them annually to make sure you're up to date on all of your health screenings, and if there's any intervention that's required, we're able to take that action before one of these would occur.
Good morning, my name is Nancy, and I'm one of the 12 registered dietitians here at the VA, and we serve our veterans who are inpatients as well as outpatients in MOVE and home-based primary care, in the PACT clinic, and also in healthy teaching kitchens. We offer a lot of modalities of appointments, so in-person, telephone, VVC, TMed, and also some group classes too, as well as the individual classes. We work with nutrition care needs of all different kinds, so diabetes, unintentional weight loss, chewing and swallowing issues, tube feeding, and of course, heart health. So today we're talking about heart healthy fats, and one of the things we focus on is we want to choose more of the unsaturated fats versus the very saturated fat and trans fats. So you want to choose more liquid versus solid at room temperature. So each of these has 100 calories approximately per dish. And if you need to get a hold of a dietitian here at the VA, one of the ways you can do that is by a telephone call, 701-239-3700 extension 3629. And thank you so much for coming today.
Hi, my name is Ann Grandy, and I work here at the VA as a whole health partner and a whole health coach. So today we're just talking about whole health and all of the opportunities that we have for employees, or excuse me, for veterans as well as employees. We have a lot of well-being classes as well as more of our clinical side. But we have a more holistic approach to healthcare where we want to help our veterans live their best life and keep moving and meet them where they're at and really find out what matters most to our veterans so we can meet them where they're at. Thank you.
Hi, good morning. I'm Dr. Stephanie and I'm the Employee Whole Health Coordinator. I work with Annie in Whole Health, but our focus is specifically on services for employees only. What we want to focus on is reduction of burnout and stress and trying to make your work life alive more productive, because we can't serve our vets if we aren't taking care of ourselves first. I want to just mention a few things we've got going on. We've got an essential oils class coming up. We've got a journaling class today. We've got a vision boarding class we just did this week, and we've got other things that are coming up. And I suggest that you look for the SharePoint or pick up one of our brochures here on the table and just check out what's in it for you. Thanks for coming today.
Hi, I'm Nicole Veselka and I'm a BLS instructor and nurse here.
And I'm Jennifer Jones. I'm our medical librarian and also a BLS instructor.
Cardiac arrest occurs when there's an electrical malfunction in the heart. This causes an irregular heartbeat. When this malfunction occurs, oxygen flow to the brain, lungs, and vital organ tissue is disrupted. There are more than 350,000 cardiac arrests that occur annually in the United States. Cardiac arrest is a leading cause of death.
And unfortunately, around 90% of those arrests that happen outside of the hospital, the victims end up dying. But there is good news. Almost immediate starting of CPR, I mean, the sooner the better, of good quality CPR can triple or double or even triple the likelihood of survival for that person.
Next, we're going to show you how anyone can perform hands-only CPR. Bystanders who witness a sudden cardiac arrest of an adult should immediately dial 911 or have a bystander dial 911. This will activate the local emergency medical services. Next, they should activate high-quality compressions, pushing hard and fast in the center of the chest at about a rate of 2 compressions per second. Or you can think of the Bee Gees song, Staying Alive, to help guide you. Staying alive. There should be minimal compression interruptions. The goal is to be off the chest for no more than 10 seconds. Remember, time equals tissue. The sooner you get oxygen back to the brain, lungs, and vital tissues, more tissue may be saved. Early intervention, even by a bystander without any additional BLS training, can save tissue and life. Survivability increases.
Especially for women. Currently, it's estimated that every 6 out of 10 women who experience a cardiac arrest outside of a hospital end up dying. And that's mainly because people are afraid to touch a woman for fear of being accused of inappropriate touching. I mean, think about that. One of those 6 women could be your wife, sister, daughter, mother, or friend. So just please know that the Good Samaritan law is there to protect people who bravely step in to provide life-saving treatment regardless of gender. So please, let's try and overcome these fears and save the lives of the people that we truly care about, both men and women.
To increase survivability at the VA, we have adopted the American Heart Association's Quality Resuscitation Improvement Program. You can see here, this is a model of the mannequin that we use. We do training 4 times a year. This includes a test out. The frequent training increases skill and knowledge retention, and it's improved to increase confidence and competency, providing life-surviving care. We do training on adults and infants.
Thank you guys so much for taking the time to learn about CPR. We hope that you guys now feel confident to be able to provide hands-only CPR and help save lives.
At this time, we do not offer bystander or layperson training. We only offer training to employees, but we encourage you to check out the American Heart Association for more information on hands-only CPR.
Thank you.
Hi, my name is Stephanie. I'm one of the respiratory therapists here at the VA, and I also do sleep medicine. and this is Danielle Pitzel. She's also a respiratory therapist here. We're just here promoting healthy sleep. We want to get about 7 to 9 hours of sleep every night. Sleep disorders affect about 70 million Americans. So we just want to bring that to your awareness. If you're experiencing snoring or extreme fatigue, things like that, your doctor could order a sleep test for you to help get you diagnosed. Sleep apnea is known to increase risk of cardiovascular disease. So we're just out here to bring awareness to that, and I'll let Danielle speak about the CPAP.
Hi, I'm Danielle, and once a veteran has been diagnosed with sleep apnea, the first line therapy is PAP therapy, positive airway pressure therapy. So once that has been completed, we would just need an order from the primary care doctor stating what pressures the veteran was ordered on, and we can get them set up with PAP therapy. We offer a variety of appointments for our veterans. We do VDC, telemedicine appointments, face-to-face and phone visits as well. We also encourage My Healthy Vet for veterans to be able to contact us that way for any therapy needs. And if you do have any questions, providers, we have an email group. It's VHAFARCPAP@va.gov. And there are other sleep modalities, and that can be referred to an outside provider if needed.
Good morning all, I'm Caroline Chen, pharmacist from pharmacy. So in the pharmacy, we have a pharmacy operation service and we have a pharmacy clinical service. So we all know that for better heart health, heart medication compliance is a must. And also if you have any question, please feel free to contact any of our clinical pharmacist practitioner about your heart medication management. And I have two awesome pharmacists today, and Miko Elias is our pharmacist operation, and he will go through the prescription refill process, method, and modality.
So yep, it's very important to refill your medications on time for, like Caroline said, good cardiovascular health and overall health. So we have a few ways to do it. Through the My Healthy Vet and then this RX Refill app where you can refill your medications or track your medications, and you can also call toll free or call the VA here, and we can fill your medications or track them here as well. So all great ways to refill and track your medications.
And we also have Katie Henson, the pharmacogenomic pharmacist, talk about her service.
Good morning. My name's Katie. I am the pharmacogenomic, try and say that 3 times very fast, pharmacist. It's a program we recently started in about August. It is a blood test. It checks genes related to medications. With that testing, we can find the best medication at the right dose for you. Currently, it looks at about 80 medications, but it's a rapidly growing field. That blood test and those results are a lifelong test, so they will stay with you. They'll stay in your medical chart, and it'll actually alert your provider if they order something that doesn't mesh with your genes. Currently, the testing is free through calendar year 2024, and any provider can order it. So it's a very good benefit to our veterans.
Good morning, my name is Bethleen. I'm an RN in primary care. Our goal is to provide some education on high blood pressure and how you can manage your blood pressure at home. High blood pressure is when your blood pressure is elevated. It's also known as hypertension, which is probably what you hear your providers say. High blood pressure can develop slowly over a long period of time, and it's often referred to as the silent killer because most of the time you may not have any symptoms that indicate there's something wrong. We'd like to encourage everyone to visit their primary care provider for checkups and to follow their provider's instructions, since this is one of the best ways to prevent and treat high blood pressure. For most patients with high blood pressure, your provider may recommend treating you to just decrease your blood pressure to 130/90 or below. But this can be different for each patient depending on your age, your health issues, and your personal preferences as well. We also want to have patients understand the causes of high blood pressure and how to reduce your blood pressure at home. There's chronic diseases and issues that can cause your blood pressure to become elevated. Things like chronic kidney disease, being overweight or obese, obstructive sleep apnea, diabetes, excessive alcohol consumption, smoking. Those are all just some causes that can increase your blood pressure. To help prevent or reduce your blood pressure, it's recommended to eat a diet high in fiber, fresh fruits and vegetables, low-fat dairy products, and reduce saturated fats, and to read labels and monitor how much sodium you're getting in your daily diet. The VA has a wonderful nutrition department, so if anyone would like some guidance with their diet, we highly recommend the nutritional department. Quitting smoking is also highly recommended. If you're a current smoker, we definitely have VA resources that can help you quit smoking or lead a healthier lifestyle in general. If you have any other questions or if you'd like to talk with your provider about hypertension management, we encourage you to reach out and schedule an appointment.
Hi, I'm Courtney Bruzik. I'm one of the home telehealth care coordinators. We are here to help you with conditions such as heart failure, hypertension, or other chronic diseases that can affect your heart. We help you through remote patient monitoring. We send out equipment to your home and program that based on what diseases we can help you with managing. We help with monitoring vital signs, educating you. The machine also educates you, and then based on responses, you will get a call from your care coordinator. Our goal is to help reduce complications, hospitalizations, emergency room visits. We work really closely with your primary care teams to do that. We have many different diseases and conditions that we can help you manage. Those are listed on there. And then home telehealth is under the umbrella of telehealth. So telehealth is a very big department. They allow you to connect with your care team to make sure you have less travel, easy access to appointments or appointments with specialty care providers. And if you are wanting a consult to home telehealth to help you manage hypertension or heart failure or other conditions, you can let your primary care provider know and they can enter that consult.
Hello everyone, my name is Amber Kuhn and I'm a registered nurse, and I am the Women's Health Nurse Navigator and Maternity Care Coordinator. As the Maternity Care Coordinator, I follow veterans throughout their pregnancy and for 12 months postpartum. During this time, I complete phone visits with each veteran about every 3 months or so, following the Maternity Care Coordination Telephone Program Manual. One topic that was recently added to the manual was about pregnancy and heart health, which includes education on preeclampsia, as it does affect 1 in every 12 pregnancies. Preeclampsia is a serious condition in pregnancy associated with elevated blood pressure. It can develop suddenly and can lead to serious health conditions such as kidney failure, stroke, and even death. It can develop in any pregnant person during the second half of pregnancy, generally presents around 20 weeks gestation, and postpartum, so up to 6 weeks after giving birth. There are high and moderate risk factors for preeclampsia, and it is important that each veteran know their risk. So some high risk factors include having preeclampsia in past pregnancies, carrying multiple fetuses, chronic high blood pressure, kidney disease, diabetes, and autoimmune conditions such as lupus. Some moderate risk factors include being pregnant for the first time, obesity, family history of preeclampsia, and being over the age of 35. Along with discussing risk factors, we discuss signs and symptoms of preeclampsia and when to call their OB provider and when to seek immediate medical attention. We also discuss ways to reduce the risk for preeclampsia, and I stress the importance of seeing their OB provider throughout their pregnancy and getting their blood pressures checked. If you or your veterans have any questions about maternity care or women's health topics, please reach out to me at extension 3503 via Teams or email. Thank you.
Hi there, my name is Mitch Riley. I'm the My Healthy Vet coordinator here at the Fargo VA. Today we're here to present some information regarding your online health records. My Healthy Vet is a way that veterans can view their health records as well as refill VA prescriptions, send secure messages, and manage VA appointments. It's available online at va.gov, and we are here to help as needed with getting people signed up. You can do that in person here at the facility. We're in office 1C96 downstairs on the main floor, or you can give us a call at 701-239-3700, and you can extension that at 4420. We also provide services for Annie, which is a way to get reminders to take care of your health. It's a really big program for us, and our providers are really pushing for it. You can find that app as well online at mobile.va.gov/Annie. Thank you for coming today, and we look forward to seeing you.